Hey, my name is Mary Beth Britt. Today I'm going to show you our cardiac monitor that we use on our ambulances and QRVs here at our emergency services. This is the Zoll's X Series cardiac monitor. I'm going to show you some functions and also how you operate this monitor. Victoria is going to be my patient. Cut the monitor on, turn the green button on. You basically have two sides on this monitor. Sometimes people call it live side, some people call it the dead side. All sides, it all works together though to do several operations. On this side of the monitor, we have defibrillation pads. These are used for patients in cardiac arrest, also cardiac patients that other things have to be done to. We have these attachments which are used for respiratory patients. They are CO2 detectors. We also have a pulse ox on this monitor. This actually detects the patient's heart rate, also the patient's oxygen level. So we're going to put this is put on the patient's finger. Put this on the finger. And once the monitor is on and you attach all this, it automatically just reads and pulls up on the screen. Give a minute and I'll let you see how that works. This is the oxygen level, this is the heart rate. These cables right here are EKG cables. We call these limb leads. They do a basic EKG. If you want to do something further, we have these leads right here, which go further in depth on the heart. I'm going to show you. This is the pads that are actually on here. You pull this off and they stick on the patient's skin. We're gonna put these on Victoria and we're gonna let you see how this works. One goes on the right arm, another goes on the left arm. We're gonna go on the right lower leg. And we're going to go on the left lower leg. And once you get these on, you have a rhythm that pulls up. All of these little what we call QRS complexes is a patient's heartbeat. The heartbeat here should correlate with what you have here. Also, we have a automatic blood pressure cuff on this monitor. Excuse me, it's all tangled up. Put this on the patient's arm. Well, you know what? I'm gonna slide your pins out of here. You want to make sure this cup is fully deflated before you start to actually use it. Okay. Hit the button and it's going to start blowing up. Also, your heart rate, all of this information here can print out onto a strip. Oh, hold on. Let's fix this. We got an error. Oh my gosh. Hold on. We're going to try this again. I don't understand why I wonder if it'd be better if we did it down at the bottom. Optional on these blood pressure cuffs. You can take a blood pressure in the upper arm, or you can take a blood pressure in the lower arm. I don't know what's going on with this cuff, so we're going to just try to go at the lower arm. And this is your blood pressure actual reading. So this is your blood pressure. If anybody is familiar with blood pressure, this is when your heart is contracting, and the bottom number is when your heart is relaxing. And last of all, show you how you print the strip off. This button right here is a print button. And once you hit that button, this will automatically go to printing. Which, like I said, all this will be on this strip. And this is normally what we leave with the nurse at the hospital or wherever we transport the patient to. There's the rhythm. As you can see at the top, you can see the heart rate's 88. It's the respiratory, the SpO2, and the blood pressure, the date, and it's normally time stamped also. And this is just a basic rundown of our cardiac monitor that we use.